Hi, my name is Dan Brown. I'm a consultant neurosurgeon based in Cambridge, and today I'd like to talk to you briefly about a condition called spinal stenosis. Now, spinal stenosis is a condition where the spinal nerves are compressed in the lower portion of the spine, also known as the lumbar spine. The most common cause of this is degenerative or wear and tear related. So, for example, the joints, ligaments, and discs thicken up to press on the spinal nerves. Now, typical symptoms that patients will present with if you have spinal stenosis can be broad. They can include, first of all, no symptoms at all. So you can have compression on the scan but have no symptoms. If you are symptomatic, you may have a combination of lower back pain, symptoms in the legs, which may include pain, pins and needles, numbness, or even cramping. These symptoms may get worse when walking or exercising. In addition to this, patients sometimes in the very severe stages notice problems with bladder, bowel, and sexual dysfunction. In terms of management of spinal stenosis, so first of all, we can try to manage it conservatively. So this would include simple analgesia, painkillers, which can be directed by your general practitioner. Physiotherapy is always useful in conditions like this, particularly to keep the muscles healthy in the lower back. But ultimately, if you're symptomatic from spinal stenosis and you have compression of the nerves on the scan, this is a very physical condition, and quite often an operation is indicated, or at least should be discussed with you. So how do we treat spinal stenosis surgically? So I use a minimally invasive technique. It's done through a very small cut on the back, about 1 inch long. I slip down between the bone and muscle and remove a small portion of bone and ligaments to recreate that space within the spinal canal and decompress the spinal nerves. Now, patients typically notice an almost instant relief, so they wake up and find that their particularly leg pain and leg symptoms improve. Sometimes there can be a delayed effect. Back pain can improve if, for example, your posture has been off during the presentation period, and there's a period of rehabilitation which is needed afterwards in terms of increasing your exercise tolerance and getting back to normal lifestyle. Spinal stenosis ultimately is one of my favourite conditions to treat because it can often be seen as it can have a massive impact on patients' general well-being and life. Often patients is labelled as just slowing down or getting old, and actually as a surgeon I can intervene and often give people a significant quality of life back.